Fraud, waste, and abuse is one of the biggest contributors to escalating healthcare costs. Here's why you should care. Healthcare fraud is one of the fastest growing crimes in South Africa. Between 10 and 15% of all medical aid claims are fraudulent. This costs the private healthcare sector about 22 billion rand per year. But how does this fraud happen? Well, think of a physiotherapist who claims to have seen 93 patients in one day. A doctor who claims to have performed medical procedures, which he hasn't, and the pharmacist who lets customers buy groceries and claims money for medicine from medical aids. In extreme cases, some professionals even hospitalize perfectly healthy patients. Medical fraud is often the result of collusion between providers and patients. Almost 9 million people depend on medical aid schemes, and the high fraud levels compromises the financial integrity of these companies. Ultimately, the cost of fraud is carried by all medical scheme members. This is through the increasing cost of healthcare premiums. Well, here's some tips to ensure you don't become a victim of medical fraud. Firstly, treat your medical scheme number like your credit card number. Never give it out over the phone unless you initiated the call. If your medical scheme membership card is lost or stolen, report it immediately to your scheme. Secondly, don't accept free medical services or equipment in exchange for your medical scheme number. Unscrupulous companies or individuals could use this number to bill medical schemes for services or products you didn't receive. Thirdly, review your medical scheme statements closely and check for services that you didn't receive. If you suspect fraud, report it immediately. Here are the details. Make your health matter. I'm Kathy Motlahlana.